Okay, I'm not about to eat this raw steak. What I want to show you though is internal fat.
Behind the mask, the more you know, the better you look. Behind the mask, the more you know, the better you look. Behind the mask.
It's a really common question that I get in the comments and the DMs is that people ask me like, well, why can't you just lipo out the internal fat just like I can do the external fat? So I'm using this steak to kind of show you what the internal fat is. So the internal fat is inside your body. It's the fat that's closer to, on the other side of the abdominal wall. Well, where is it inside? So it's in your organs. It's in your mesentery, it's in your pancreas, it's in your liver, it's in your organs. So imagine that this is your internal fat. The internal fat is mixed with all of your organs. So the external fat is just a solid layer that's just skin and then fat. That I can remove. But this fat, the internal fat, is mixed in with your organ. And so even if you slice it, you'll see the fat is throughout the organs and it's all throughout the meat. So it would be impossible to go in with a liposuction cannula and remove these bits of fat because you would destroy the organ. It would be fatal for you. If I liposuctioned your liver, you would die. So that's what internal fat is. And you can imagine that this patient here has a lot of internal fat. And so these are the patients that we would have lose weight prior to surgery. This fillet, as opposed to, this T-bone, this has less internal fat. It's a leaner cut of meat. So there's less internal fat here. So this is somebody who would be a good candidate for surgery because they really don't have much fat inside their body. So most of their fat would be outside of their body. And so if you imagine that the fillet is somebody with a low internal fat, mostly their organs are just composed of their organ and there's not a lot of fat inside, those patients are good candidates for liposuction because they just have fat on the outside of their body. Those patients that are more like a T-bone, for example, I'm probably a T-bone, they're going to have more fat on the inside of their body, that internal fat, and more fat throughout their organs. And so this is just too much fat, and it's going to be projecting from their abdomen. And so they're not going to be good liposuction candidates. The nice thing is that if we put this person on a diet and they lost weight, then these fatty deposits would shrink and the fat inside the organ would shrink. And as that internal fat shrinks, the shape in the abdomen gets flatter. And then they would become a good candidate for liposuction because we'd be removing the external fat. So think of this as somebody with high internal fat, not a good candidate for liposuction, can't go in and remove it because you would tear all of this meat apart if you did liposuction. So we can't go in and remove the internal fat. This is a better candidate for liposuction because this patient has less internal fat and is leaner and has a flatter stomach to begin with. And then I just take the external fat. So that's it. Heavy internal fat, light internal fat. It's time to grub.